to wake up. Then you have Opana, which is like it's like a pain reliever opioid, which is 7 to 9 hours. All right, so these five simple steps. The first thing is always make sure you call for help. You call Alcorn State Police here, or if you're out in the community, call 911. You want to always make sure you check for signs of an opioid overdose, and we'll talk about some of those signs. You want to always make sure you support that person's breathing in the recovery position. Does everybody know what the recovery position is on the side? It's kind of like CPR. And then also, you want to administer the naloxone and monitor that person's response. All right, so some different signs of an opioid overdose is the person is, they have limp fingernails, they have sleepy in the eyes, a real limp body, pinpoint pupils, but normal sized pupils don't rule out a person that's in overdose. And also the most important is the breathing problems. I believe when we trained those guys from Gluckstadt Police Department, that young lady had a death rattle. So it was about 20 minutes until they came and when they administered the naloxone. And if you hear this emergency, well, it's always necessary to immediately, first of all, call 911 and always make sure you monitor that person. So while you're supporting that person's breathing, always make sure that their airway is clear first. You place one chin on the person, well, you place one hand on the person's chin, tilt the head back, pinch their nose closed, and then you place your mouth over the person's mouth to make sure the seal is given 2 breaths. And like I said, Logan will go over a lot of things that's in your overdose kits. The person's chest should rise, but not the stomach. And then you allow that person to breathe every 5 seconds. All right, and then you place the Narcan. You place the Narcan nasal, and like I said, it's just a really small nasal with a lot of power. You put that end of the nasal in your nose, and your two fingers, as soon as it touch it, and then you press that firmly, plunger forward, and then that is when the medication will dispense. And then that's when you'll start to see a change in that person with the overdose. All right, we talked about the recovery position, so you put that person in a recovery position first. If that person, a lot of people ask, well, can you give 2 doses of Narcan? Yes, you can. So if that person is not starting to wake up after that overdose after 3 minutes, then you're able to administer another dose of Narcan. If the patient responds to Narcan, to the spray, and has a relapse back into the respiratory like I said, everybody will be receiving 2 doses. So you want to always make sure your naloxone spray is at a really good room temperature. Do not freeze the Narcan, or do not keep it hot, because that will pretty much mess up the efficiency of the Narcan. You want to keep the spray in the box until you're ready to use, so you can keep it away from light. And replace the Narcan spray before the expiration date. And the expiration date is in 3 years. So it has a 3 year shelf life. So about 2028. So the Narcan you receive today, the expiration is in 2028. And then last but not least, you keep the Narcan spray and all medicines out of reach of children. So there's several risks that we don't know if that person who's overdosed, if they have any type of diabetes or cardiovascular, and a lot of people don't realize that you can also give Narcan to kids as well, and that's what we'll get into. So using the patients who are opioid dependent may precipitate opioid withdrawals characterized by body aches and diarrhea. And always making sure you monitor that person to develop that opioid withdrawal. The risk of cardiovascular effects, abrupt postpartum reversal of opioid depression may result in adverse in the CV efforts. These events have primarily occurred in patients who have pre-existing disorders. And as always, make sure you monitor that person very, very closely. All right, now in the case of if you're using naloxone, and that's why we always tell people to make sure you're keeping your medicine cabinets and pills away from kids, because kids also can overdose as well. So a sudden opioid withdrawal for an infant or a child may be life-threatening. And the signs and symptoms are excess crying, seizures, and an increase in reflexes. So that is the end, and all of these risks means what? Additional medical attention will be required. So that is it. That is my presentation. Thank you so much for having me. At this time, I'd like to invite Logan up. He's going to explain everything in our overdose kits that we will be receiving today.
Thank you so much, Ronald, and thank you all for being here today. This is my first time on All-Car State campus, and I just wanted to say it's a beautiful campus, and Ronald has showed us around today, so it's been great to be here. Thank you all for having us. I work with the Mississippi Public Health Institute as well. These guys we're all a team here trying to reverse opioid overdoses and prevent deaths in Mississippi. So you heard a lot about what Ronald said about what Narcan is and how to use it. So thank you for coming to this training. Like we said, everybody today, if you meet us outside after the training, just sign in on our sign-in sheet and we'll give you a free kit. And I'm just going to go through real quick what's in the kit. Real quick, I just wanted to mention that one thing I was worried about when I first learned about Narcan is, what if I don't know if this person's having an overdose? What if I think that they might be having a heart attack or some kind of other health issue? You can give Narcan to someone if of course you'll suspect that they have an overdose. You wouldn't just give it to anyone, but it is not life-threatening if that person is having another health issue. It's not going to hurt them. Of course, you always want to call 911 if you're administering it at all, but don't worry about that. So let me show you what's in the kit. These are the kits, and this is our opioid overdose kit. Everyone will get one of these today. You have 2 doses of 4 milligram Narcan, the nasal spray that Ronald just talked about. Get this out here. You also have 2 fentanyl test strips. So this will test any drug for the absence or presence of fentanyl. So that's important to have. If you know, like Attorney General said earlier, if you know someone who maybe failed a pill, or if you get a pill or know someone who has one, you want to test that and make sure, because one pill can kill. So we have some fentanyl test strips here. We also have a card with steps on how to use basically this whole presentation on this card, so you know how to use it and you can remember later. And the Attorney General also has this in their kit, but medication disposal bags. So if you have old medication, expired drugs, and you want to dispose of them in a safe way, you put them in the pouch, fill it up with water, and throw it away. And it's a safe way to dispose of old medication or drugs. That way it doesn't go into the water system. So that's the medication disposal bag. And then a couple more things. We have gloves in here, so you don't have to touch any medication or possibly fentanyl, and a CPR mask. So that's everything in the kit. after the presentation today, just see Brian around at the table outside and sign our sign-in sheet, and you will go home with a free kit today and hopefully have the potential to save a life. So we thank you all for being here today, and hope everybody has a great day.
All right, thank you, Logan and Ron, for that presentation and demonstration of the Narcan. Once again, highly encourage all of y'all to get one of those kits, as well as our prevention kits. We have our prevention kits available as you guys are leaving as well. We're going to leave some with some of the Alcorn State staff as well, but we want all of you to leave here with at least one kit that has some of the resources that we're going to talk about here. So I'm Joseph McClatchy with the Attorney General's Office. Also want to introduce Justin Sims with our office as well. He's an investigator. And so as Stephen's setting up some of the live stream, what we're going to try to do is get a kind of a live, almost like a cooking class video over here so you guys can see exactly some of the different pieces. And we're actually going to do a demonstration of all of these tools that we have that are here in our prevention kits. So in 2022, 2.3 million opioid prescriptions were dispensed in Mississippi. Now, if every single one of those went to a different person, that's 78% of the population of Mississippi that would have a prescription. And that's not including counterfeit pills. So that's one of the main things that we've talked about, and as part of this initiative is not your pharmaceuticals, not your drugs that are coming from licensed people that have quality control and all those things. It's the pills that are being made in these pill presses that there is no quality control that has this fentanyl waste with it. And so that's our main concern. And so all of these things that we have in the kit are going to protect you from that. So one of the first things that we're going to mention in the kit is this push cart here. And so the front of it has how to identify whether a pill is a real, say for instance, a real Xanax versus a counterfeit Xanax, or an Adderall or an oxycodone as he was mentioning. And so that's one of the ways that we can test is if you look at some of the details, you can see that these pill presses are not very usually well made, right? And so you can tell some of the differences. Now, on the back of this push card also are just some tips to protect yourself from fentanyl, things that you should stay away from, using social media to buy pills, taking pills that are not provided by pharmacy or a clinic. So we'll just kind of jump into to kind of a real world example. So one of the first things you do, so let's say you go to, for instance, a fraternity party, or you're hanging out with some of your friends, and this person you may not know provides you some pills, says, hey, take this, right? But you're really not sure. You've heard about fentanyl. You're not really exactly educated, but you got this prevention kit, right? So the first thing you're going to do is use these gloves. As was mentioned, as the Attorney General mentioned earlier, you don't want this on your skin. You don't want that touching you and getting ingested that way. So the first thing you're going to do before you handle anything that you're not familiar with or you're a little unsure about is put on those gloves. And so the next thing we're going to do is like take, for instance, the drugs. So you've got a couple of pills that somebody that you don't know gave to you. So the first thing you want to do is to dissolve a small amount of the drug that's in question into some water. And we're also going to be sure to, say for instance, if you have, if it's not a powder, if it's actually a pill, kind of get some of the different sides of the pill. We think of fentanyl as like, say you're baking a cake, there may be a small amount of powder that's very concentrated on one, say, muffin or piece of the cake, as opposed to the rest of it. So the same thing happens with the pills. You want to make sure that you get kind of all around the pill so you're kind of hitting all of your different areas. So you then pour a small amount of water into the liquid for about 15 seconds. Now, because the test strips are very highly sensitive, a minimal amount of the drug residue is sufficient to get some of these get some of these results. So you'll open the actual test strip up. We have 2 in each of these kits. You'll pull the test strip out and give it about, how long do you typically give it, Justin? About 15 seconds. I want to say that Justin is an investigator in our office that has been on many of these high-profile drug busts that you may have seen in the news. He has a lot of real-world experiences, and he uses these very strips because he actually trusts them. So if Justin uses them, then they're pretty safe bet that people on college campuses can as well. So I just want to say also, once you actually test the test strip and it has the liquid in there, Set it on a flat surface. Usually results appear within about 5 minutes. Now, I want to also say that in this test strip, it's almost the reverse of a pregnancy test, right? So one line indicates that fentanyl is present, so that's a positive. 2 lines would indicate that it's negative. I think we're maybe seeing some results here. So it's it's a 1 line, very, very dim, but it is a 1 line. So we're going to actually move on from, so we've used the pill, push card to identify counterfeit pill. We've also used the test strip. And the last thing we want to talk about, I know all of these are red, but they indicated in there, but this is the medication disposal bag. So let's say that we test these, they're testing positive, we determine that there is, possibly fentanyl in theirs, and you don't want to handle these, you don't want to put them in your pocket, you want to put these in the bag, and then pour a little bit of water into that bag, and then it actually has a Ziploc mechanism that you zip those up, and it renders that unusable, right? Then dispose of that properly. So all of these resources are very important to protecting you and your loved ones from this extremely dangerous drug. Once again, I hope that you guys will pick up some of these test kits on your way out of here. They're invaluable to saving people, like I said, that you love. And as well, also please see the people at the Mississippi Public Health Institute. They're going to give you guys some Narcan. Don't underestimate how powerful it is. Not everyone can get Narcan, so you guys are very blessed to have a grant that provides that in this community and into this college campus. So we thank you all for your commitment. We thank you all for being here, taking the time out of your day to sit through this training and be part of this announcement. So we appreciate y'all's partnership, and we hope you guys have a wonderful rest of your day.
Excuse me, if you did not sign in on the billboard, please do so on your way out. Thank you.